Welcome to the Tell Our Stories podcast. I'm Ryan McNamara, and today we're inside Direct Supply's Innovation and Technology Center with Liz Jensen, Clinical Director at Direct Supply. She's a nurse leader who spent her career at the intersection of clinical practice, product development, and real-world implementation. We'll talk further about how the Spark Collective helps clinicians and developers make sense of ambient sensors and robotics so technology can help lighten workloads in senior communities instead of adding to them. We'll cover cross-disciplinary decisions that can help improve outcomes and lower risks. And lastly, we'll tie all of those together with our key issues: strengthening the workforce, securing fair reimbursement, and adopting tech thoughtfully so providers can focus on human connections at the heart of care. Because behind every statistic is a story, and every story is a call to action. This is the Tell Our Stories podcast. Welcome to the Tell Our Stories podcast. I'm Ryan McNamara with Direct Supply, and I'm joined here today by Liz Jensen, who's our clinical director here at Direct Supply. So thank you so much for joining us today, Liz. Would you mind just giving us a little bit of an intro of yourself and your role here at Direct Supply?
Sure. Hi, Ryan. Thanks so much for having me. I love Tell Our Stories, and I appreciate the opportunity to be a part of this. So thanks for the invitation.
Yeah, have you?
Yeah. So my role at Direct Supply is kind of a unique one as a nurse. I've been the clinical director here for the last 13 years. Prior to that, I was the senior vice president of clinical practice for a large skilled nursing operation, and had spent most of my nursing career working in the long-term care space in a number of different places and spaces. One of them in particular, which was maybe of interest to our listeners, in a conversation with some of our supplier partners recently, sharing with them that my entryway into long-term care was actually working for a long-term care pharmacy. So I came into long-term care from the acute care space working for a vendor, for a business partner to nursing homes. And as a nurse, working in communities, helping to establish their infusion therapy programs, and just learning how important that provider partnership was between the business of the nursing home and the business of the pharmacy. Those two really had to work together in tandem. So that's some of that inhabits my mind and my work as I think about the work I'm doing here. At Direct Supply, we've got a lot of opportunity to work with a number of suppliers in a lot of different areas, a lot of different product areas, technology areas. And so being able to help them connect to the mission and what the work is that we're actually trying to do. I find myself being a bit of a translator of, what's kind of happening out with our customers and what we can do together to help with solving some of those problems. So that's a lot of kind of high level
Great.
of some of the
That's
things I do.
perfect. Yeah, I think I appreciate Liz's work in helping us understand as a supplier organization, but also as a larger senior care community, some of these changes that happen at the state level and the federal level in terms of changes to regulation and policy, but really how does that filter down to the folks that are delivering clinical levels of care, right? And who are dealing day to day with residents and seniors in those communities. You always offer such a great perspective in terms of drilling down to what does this mean in practice and how are we going to be able to help providers implement some of these changes that we see. And I'd love if you could talk a little bit more about your event and your role in the Spark Collective and how that went. I know that was a recent event here at Direct Supply, and I'm hoping you can give the audience just a little bit of perspective in terms of what that event is and how maybe some key takeaways.
Yeah. I would talk about Spark anytime you give me a chance to, because we actually celebrated our 15th year this year. Spark started as a clinical product advisory board on the product side of our business. And it was really for the purpose of it was to get nurses together with our product developers and our product managers to give them insights into the things that they were developing. And so my passion is getting the end users, paired up with the developers themselves so that they can have input in those either products or technologies early and often. We've evolved to become the Spark Collective now, which is a group of 100 plus clinicians that are at any given time are willing to come in and give us their feedback and insights into the challenges and the problems that they're facing, and letting our product developers and our technology developers, our data scientists, learn from them. And that has been a huge passion of mine, and the excitement that comes out of that, right? Like, it's really cool. So the two kind of big areas that we're working on right now are, what is the role that ambient sensor technology is playing in how we care for folks? And then the other project is around robotics in a care setting. So what's the role that robotics will play? We really have to be thoughtful about what we're expecting technology to actually be able to do for nurses and nursing assistants. What do we not want it to do?
Right.
And how are we navigating some of the challenges right now with lots and lots and lots of technology that's coming at us, and making good decisions about the technologies that we're going to choose to pilot or implement, what that does and the burden that it places on our staff sometimes to make those changes. There's so much to think about. And so the Spark Collective is really our opportunity to vet some of those ideas out with them, get their feedback on things, and it really helps to shape some of our thinking for our work going forward.
I think it can be so hard for providers to kind of weed through the different changes in technology, right? They're focused on delivering care day to day. And it's great that you've helped develop this group that's able to kind of weed through and cut through some of that noise, because you're right. So much discussion on the role that robotics can play, so much discussion about ambient sensor technology, discussions about remote patient monitoring and other types of technologies that could help provide a higher level of care. But as a provider, it can be really difficult to understand in that environment what are the best solutions and how can we implement them effectively. So I believe that Spark is such a great example of what the industry should be trying to do more in terms of collaboration and finding partners who are willing to help ask questions, right? And
Yes.
give feedback.
Yes.
Because I think too often suppliers or providers don't always speak the same language in terms of implementation, and it's really good to get those folks in the room. So how many provider or clinicians did you have here for the Spark?
So this year we had 25 clinicians. And these are nurse executives, nurse leaders of some of the largest senior living, multi-state, multi-facility organizations in the country. And they really value this opportunity to come in and, give us their feedback. And it's great networking opportunities for them too. I think they tell me afterwards that they feel like they're being heard.
Right.
And that we're, and then it's on us now to do something with all this really valuable information. Like, how will we respond, right? As businesses, as leaders, as partners together. And I think there's evolution of partnerships that are happening already, and they're going to have to continue to evolve. There's going to be more and more of a need to figure out, how do we blend our partnerships? How do we come together to solve problems? Who's good at what? Who's better at something else? How do we let go of some of those maybe old ways of thinking about doing business? What are some new models of business we have to be thinking about? Yeah. Are there win-wins for everybody? Is there a way to imagine that? And I think that's what Spark, that's what our time here, the work that we're doing here out of the Innovation Center, I think opens up some of that ideation, some of that opportunity for discovery work and thinking differently.
Yeah, I love that. I think your role as a clinician is so unique in that you've had the experience being in communities, delivering care yourself, and then now helping suppliers advise them on best practices. And I think as we get wrapped up here, I think it would be great if you could give me one or two visions or dreams that make you hopeful about senior care going forward. Two or three things that you think are really encouraging and that you see impacting the sector in a hopeful, helpful way. And maybe giving the listeners in the audience a little bit of a high level understanding of what, those solutions or innovations or visions are.
Yeah. I love the question, first of all. And my mind's like, whoa,
Too many options, right?
There's a lot. There's a lot to be hopeful for.
Yeah.
I came out of a risk summit the last couple days. So I spent a few days with, insurance
Thrilling
folks, underwriters,
Yes.
right? Risk folks that aren't typically the most optimistic people to spend time with. But I mean, it's a sobering analysis sometimes to look at, but those are important lenses to look through as well. And they're important partners to senior living providers. One of the hopeful things that I heard was some of the different ways that providers are bringing their own teams together to form working groups for technology evaluation. They're recognizing that the importance of having cross-discipline, interprofessional groups across their organization thinking about these things, that technology decisions should not just be the domain of the chief information
Sure.
officer of over the organization, that the different stakeholders that are involved, and sometimes those stakeholders are people outside of the four walls of their organization. Sometimes the stakeholder is an insurance agent
hmm
who, when they better understand some of the implementation and the technologies they're trying to use, they can better understand how it's lowering risk and gives the opportunity to say, are there ways that we can lower insurance rates, right? Like if it's actually going to deliver on the outcome that is intended, what are the benefits then that could come with that? And I think that to me is really, inspiring and hopeful to think there's different ways that our providers are thinking about doing business differently already as well. I think one other thing you asked, kind of visionary wise, I think as I think about the future, I think that the opportunity for people who really care about um, aging well, I think, for all of the challenges that having to deal with, are we going to care for this very large population of aging society? We are all those people.
Right.
And we should always keep that in mind, that they're not others. We are the same. We are those same people. The things we're investing in now are the things that are going to impact you.
Right.
They'll impact, the team that's putting on this podcast.
Well,
They're,
and we
they're
will
going to
one
impact
day
everybody,
we will
right?
one day be the folks who need
Yeah.
care on the back end, right? So
Yeah.
it's so important to kind of build up a secure infrastructure for senior care today because
Yes.
those challenges are not going away. In fact,
No.
with increased lifespans and longevity, we're going to see more and more demand for an aging infrastructure in this country that
Yeah.
supports seniors, through aging and allows them to live a healthy, happy life. So I think you're right. This is something that all of us, even young folks especially,
Yeah.
need to be engaged in right now because it is a big topic of discussion.
Yeah. And it touches us on every single layer and level of our society,
hmm
and I think that opportunity to connect with what it means to be human, what it means to, live a purposeful and meaningful life, to have work you enjoy doing, to have, friends
Yeah.
and family that you enjoy spending time with, and having the health and, ability to do all of those things. I mean, there's a lot to consider when we think about access to healthcare, access to, addressing some of those social determinants of health
hmm
for everybody.
And could you just briefly, you have a lot of experience dealing with folks that are in the workforce broadly in senior care communities. A lot of challenges on the workforce side in terms of having enough folks to work in communities, and we're seeing that as a major challenge in the sector writ large, but also, provides a challenge on the access to care side as well.
Yeah.
So if you had a message for folks that are thinking critically about how to address some of these workforce challenges, what would your message be to some of those solutions, or what kinds of things should we be considering to address some of those challenges on the workforce side?
Oh man, that is a big question, isn't it? Yeah. I mean, so here's what I would say is that I think that, the pandemic uncovered it created a lot of aha moments for a lot of us, right? For all parts of our sector and policymakers and so forth. I think that understanding that at the very heart of it all, there's a human that's going to get up in the morning and have to figure out where she's going to take her kids for childcare. Does she have childcare? Can she afford childcare? Does she have to take a bus to get to work? Like all of those things, right? Like how are our societies supporting the people that want to do this kind of work? And are we creating opportunities for our workforce to be able to for them to live a good life too, right? It's not just about a wage. It's not just about having benefits, but where are they going home to live? Do they have to travel an hour and a half to get home?
Right.
If we don't have affordable housing in some of the bigger cities, that's a real issue. So I think the more we can think about that very human part of our care workforce and what it means to actually the supports that they need to
Right.
live their best life. I'm of the belief that when you can help somebody achieve their best sense of self in life and they understand their purpose, that the outcomes will follow, right? So, chasing resident outcomes isn't something that a technology is going to fix. We're not going to push a button and say, "Oh, great, now I'm healthy and well and happy." It's going to come through that organic interaction that happens between the caregiver and the person that they're giving care to. And when that caregiver feels cared for, the amount of care that they're able to deliver and the quality of that care changes. And we've seen that. I think we lost so much. We were making, I think, some really good strides prior to the pandemic, but we've lost so much, and we're still recovering, right? We're still recovering, and so I think policies that can be thoughtful and supportive of that kind of thinking, right? Those kind of programs that you can't just solve one part of it. You have to think holistically about the person.
Yeah, I love that. I think part of our work here at Tell Our Stories and with the Senior Living Advocacy Organization has been to find creative solutions to the workforce challenge. And I think among the many options that we've considered, we've continually supported the Caring Across Generations Act, which would provide opportunities for individuals who work in senior care communities to have childcare cohabitated on site where they work in senior living communities. And so you talk about that single mother who's going to work every day in a senior care community and has to find daycare options for her children. And now, we can do two things at once and have her children taken care of in the same community that she works. And then, of course, the intergenerational benefits that we get in seeing seniors interact with children. There's a lot of research that shows that improves outcomes for both the child and the senior. So
absolutely,
I think that's just such a great example of the kind of work we're looking to do here at Tell Our Stories and in partnership with all your work, Liz. So very well said. Couldn't have said it better myself. I appreciate you spending some time with us today. And thank you so much for joining the Tell Our Stories podcast.
You bet. Anytime. Thank you so much for having me.
We look forward to having you back again soon.
Okay, we'll do.
Great.
Thank you.
Thanks. Big thanks to Liz Jensen for joining today. Our takeaways are super clear. When clinicians can work with developers, providers, suppliers, and risk partners under the same umbrella, innovation becomes not only practical, but helps improve outcomes and respects the people doing the work and the seniors who depend on it. As our nation ages, progress really means supporting the workforce beyond wages, thinking about childcare access and intergenerational care models like the Caring Across Generations Act, funding family care so providers can invest in the right technologies without sacrificing human touch. That's how policy can get out of the way and start supporting those who need it. Let's build on the existing and aging infrastructure and make sure that we're meeting the demand of the moment. Visit tellourstories.com to explore the key issues and share your story so policymakers hear what's working and what needs to change. I'm Ryan McNamara, and this is Tell Our Stories, where policy meets people.